This episode is brought to you by Rhapsody. You want to accelerate your efforts on interoperability? Have a chat with Rhapsody. If you want a platform with seamless data integration, one supporting all the protocols for improved operational efficiency, talk to Rhapsody. They simplify data exchange, helping you drive digital transformation and deliver better patient care outcomes. Revolutionize your approach to interoperability. Visit thisweekhealth.com/Rhapsody today and unlock your full potential. Today on UnHack the News.
The primary attack vector is shifting from your end user clicking on a phishing link. That's still a big problem, but I think it's shifting toward unpatched, unremediated third-party software that's in your ecosystem. One of the articles I read in preparation for our discussion talked about that as the new soft underbelly of healthcare institutions.
Hi, I'm Drex DeFord, a recovering healthcare CIO and longtime cyber advisor and strategist for some of the world's most innovative cybersecurity companies. Now I'm president of This Week Health's 229 Cyber and Risk community. And this is UnHack the News, a mostly plain English, mostly non-technical show covering the latest and most important security news stories. And now, this episode of UnHack the News. Hey everyone, I'm Drex, and this is UnHack the News. I'm really excited today. Got Kevin Day from Rhapsody. We're going to talk about a bunch of different stuff, M&A and data, and maybe even the HHS Wall of Shame. Kevin, welcome to the show.
Oh, thank you so much, Drex. It's a thrill to be here.
This isn't something I normally do, but it's the first time we've really had a conversation. First time Rhapsody's been on UnHack the News. Tell me a little bit about your background. Tell me a little bit about what Rhapsody does.
Sure. Well, I'm Chief Technology Officer of Rhapsody, and I've been with them for almost 4 years now. Prior to that, my career was in finance, tax, and accounting. So really high stakes environments for the last 25 plus years. But really now I'm pleased to be in high stakes environment with a very honorable purpose. Rhapsody, we have the opportunity to serve thousands of customers worldwide with our digital health enablement platform that provides the data interoperability layer with our award-winning interoperability integration engines, but also the opportunity to protect identity information and matching identities so that our customers can know they always have the right person at the right time with the right data. And we also offer a semantic terminology. It's a pleasure to be here, and I'm really glad we were able to get together today.
Yeah, me too. So I'm going to hit a couple of stories, and we talked a little bit about how we do this. We can dig into the stories. Mostly the stories are sort of like the opportunity for us to just riff on some of the issues that sort of come out of those stories. But there was one, it's out of MIT Insights. One of the stories is 96% of healthcare executives are ready and resourced to use digital health solutions. Yet 2/3 say interoperability is a tough challenge. I mean, I can tell you we just did 4 summits. I was involved in 2 of them. One of them was CIOs, one of them was CISOs. And a big part of the conversation in both of those rooms was around data, figuring out what the source of truth is for data, the whole data governance conversation, and then how to line that up for reporting and exchanging and everything else. You must see a ton of this as you go across the country. Tell me some of those stories.
It feels like the digital health mandate was well over a decade ago, and yet there are still healthcare institutions, especially those in the remote settings, that are just struggling to get the right information. And when you think about health records in general, as soon as you run into a problem, is it this person or this person, you end up just giving up and creating a third disparate.
Oh my gosh, the duplicate patient record problem. That's a whole thing.
Yeah, it's incredible. Actually, just to share a quick personal story. My father, he's in his 80s and he's suffering from kidney problems. Every time he goes to the specialist, they start all over. And it's like they're wasting so much time and resources to get him the care that he needs. What we're seeing, and I think it's going to perhaps get even more acute, not to overuse that word, but as these institutions have an opportunity to actually gain real benefits in AI, if they don't have the digital superhighway going, they're going to lose out on that opportunity. So this is the right time. And the real problem is you can't dictate what you're getting from upstream. So EMRs, EHRs, CRMs, Workday, you can't dictate the formats that you're getting from those upstream sources. And also your organization may be on the left end of the spectrum in terms of being cloud enabled. So you're having to connect systems from on-prem into the cloud. You're being dictated to as to how you connect to those systems. And often that requires a whole governance process to get going. So it can be an extremely slow and discouraging process to get into the digital health data spectrum.
It really kind of starts at the very beginning too, right? I mean, going back to the duplication record issue, training the people who are on the front lines, who may not be the highest and paid employees that we have, to search in the right way to make sure that they find the patient that is actually standing in front of them, instead of sort of like taking the easy route and saying, I'm just going to create a new record for this patient, because it really affects the patient and their safety too, right? Like with your dad's background and experience, instead of asking all those questions again, which he may not remember all the things that he should say every single time, right? That's what the record's really for.
Yeah, exactly. And I think it's safer to start over, but at the same time, it's just wrecking the continuity of care. And it's a huge administrative burden on the organization itself. We do specialize in not only data interoperability, but identity management. And the problem that we're trying to help solve for our customers is that the opportunity to deduplicate data. And we really believe that AI can help with this problem, but there still has to be the organization's workflow and processes that are enforcing the system of record. And what is your source of truth? And then through tooling, like what we offer at Rhapsody, certainly, but through tooling, you can actually enforce the system of truth and make sure that the staff is well trained, but also that you are incorporating common sense automation to help that process. We have a lot of customers that come to us with hundreds of thousands of potential duplicates and with no idea how to tackle that problem. Do you just push the reset button? Do you need to put an army of data stewards at the problem in order to actually make a difference?
I think about my days as a CIO. There was a regular process that we ran to eliminate duplicate patient records, but that's really kind of only part of it. And if you can use AI to help with that, obviously streamlines and takes probably some degree of pain out of it. At least by the time it gets to the human to look at it, they have all the things that they need to make a reasonable decision pretty quickly, instead of doing all that research on their own. But then that data flows to other organizations, right? Other organizations where patients and families get their care, where they may get prescriptions or other tests. That's incredibly important. And that sometimes gets lost in the shuffle too.
Yeah, for sure. And I think that your ecosystem needs to have the flexibility, not only to specify the source of truth, but how the data traverses through the continuum of care. We allow it to come from this sending source. It's going to get deduplicated in this arena, such as an integration engine. And then we're going to enable it to be part of these major workflows. And so that way you always have line of sight of where the data is. You have the assurance that it's protected and encrypted every step of the way. And you also, again, you're enforcing the rules of the game. So that way the provider can be efficient with that information.
I want to switch over to another story about M&As, if you're okay with that.
Absolutely.
All right. So there's a story in Becker's about M&As that have been finalized in 2025. This seems like we're on a definite drumbeat. We have been for a few years. Smaller hospitals get swallowed up by larger hospitals or bigger IDNs. It's not always like that, but that's generally the pace. The story says 17 hospital M&As have been finalized in 2025. And it's everything from HCA to New Hampshire to Florida to Sanford Health and Marshfield Clinic, and like just right on down the line. A really interesting list of folks. In some cases, I saw one here, even one of like the county health systems just making a decision that the county of Santa Clara needed to assume the operations of a regional medical center there on April 1st. So you see a lot of like, how are we going to keep these smaller organizations running? And that M&A process is really difficult. And I know you see a lot of M&A. What's your feeling about how this is going and how we can maybe do it better? Some stuff you see from the field?
It does seem constant. Our customers are coming to us at that point of, hey, we're the gaining organization and we are acquiring. And it's usually, I would talk to the CIO or the CTO or their head of IT operations. Often they don't know that it's happening until it's happened. So there's, what one key suggestion is, especially at the CIO level, make sure that your team members are part of that due diligence discussion And you have to have the trusted members of your team, if not helping influence the decision, at least coming up with the risks that need to be managed.
Look, I'm 100% with you. These are all experiences that I've had too. And it is, I think you do yourself an injustice if you're a leadership team in a health system, you're doing an acquisition, you don't have the CISO and the CIO at the table, because those folks really are risk focused kinds of people. And they'll also help you understand that maybe the deal you're making isn't as good as you think the deal is because of the underinvestment in the system being acquired or whatever the case may be.
That moment in time when it's announced before everything is integrated, that's the soft underbelly of M&A activity, and it's ripe for cyber attack. And that's exactly what cyber criminal professionals are looking for. Those windows of opportunity when the SSO system, for example, is in two different directions. Maybe you're not enforcing that every end user has antivirus. Suddenly now you've spread out your attack vector to the number of employees in both organizations. Our customers are coming to us. They're facing those integration challenges as an organization, but they're also facing the disparate methods in which data is brought into their workflows and continuums, and they need to reconcile that. They don't want to operate on N number of interoperability platforms. So they often come to us in consolidation, migration, and convergence. It's usually also an opportunity to look to see if the smaller organization that's being acquired, are they SaaS or in cloud? Is this an opportunity to migrate them up? But we all know this is the time when your organization, even the large, maybe highly secure gaining organization, they're absolutely also more vulnerable to cyber attack during that process.
Yeah, for sure. The other thing I was just thinking about, so I mean, it's sort of interesting to hear you say you help them with their application rationalization process, looking at that. And again, this is in the spirit of like everything's connected to everything else. A lot of that is looking at all the apps on the acquirer side, all the apps on the acquiree side, figuring out what data you need to bring over. But in the process of that, is that when you wind up helping to sort out the app rationalization piece?
I think that's the best time. And it goes back to did you account for that in your budget for the integration? And I have to admit, our Rhapsody is formed from a lot of great products and companies over time, and we're unified in our digital health enablement platform. But we're 5 companies over a period of 5 years came together to form what we have now. And I'll be honest with you, we just reconciled not having 5 different code repositories to use software. So if you don't fund it up front, you're going to pay for it until it really is a problem. We happen to have converged on code repositories so we can get real leverage of coding assistance now with AI. But I think that's a great time to do it. You decide that during this period of convergence and coming together, we are also going to tackle these things. I think organizations also, they get stuck into, well, I'm on a 3-year term. So why would I address that now and leave this? I'm still having to pay this original solution. I get it. We want to come over here, but we've already paid for this. It's a sunk cost. Shouldn't we leverage it? And I think that's a tough decision to make, but often you can, with financial reporting, and you can draw that below your earnings line and just focus on the operational expense going forward.
Yeah, don't let that automatically be a no, we can't touch that. There's other, I mean, sometimes both organizations are customers of that partner. They want to keep the big one. They might be willing to make some kind of a deal on the small one to let them out of the contract or something in exchange for something. Be flexible, right? Be negotiable.
Exactly. Yeah.
One of the other things we talked about that I don't think a lot of people know about, but just sort of like the state of the state when it comes to breaches and exposure that's happening in healthcare right now, the HHS Wall of Shame, the breach portal. I know you were out there poking around. What'd you find?
So I think we all know the rules. Like if your breach impacts more than 500 people, you're legally obligated to report it. Now, keep in mind, these are under investigation, so they could turn out to be false positives. But there's this month alone, 28 breaches. So the month of June 2025, 28 breaches impacting more than 5 million people. And you look at the cause, I get it. They're mandatory reporting, there's limited information, but they're all admitting to hacking IT breach, I would say, on 70% of those 28. So to me, this means that the primary attack vector is shifting from your end user clicking on a phishing link. That's still a big problem.
Sure.
You absolutely need to protect against that. But I think it's shifting toward unpatched, unremediated third-party software that's in your ecosystem. One of the articles I read in preparation for our discussion talked about that as the new soft underbelly of healthcare institutions.
It's really interesting too. So as we sort of talk about this, the number of those, I go out there and tiptoe around through that site from time to time too, because the data is really interesting. And I'm usually trying to figure out, like, am I really seeing a trend or not? A regular trend too around third parties. So a lot of these breaches, hacking incidents are actually tied to BAAs, business associates, who are breached. Their own security has some kind of a problem. They're breached, but it turns out that they're the core system for something for 25 health systems or 500 health systems. And so all 500 of those health systems had data lost in that breach. Now the BAA may have to report it, but all 500 of those health systems have to come back and report it too. So that can be another angle on this.
What do you call that? A recursive problem that just exponentially each level gets worse and worse. And I think that on your site, you link out to the Yale New Haven breach of 5.5 million records. Like, how did an institution of that size end up having 5.5 million records lost? Maybe I'm mistaken, but I believe that's way beyond their normal patient population. Must also include research records that were through a BAA granted to them. But the whole thing is they have to report that the whole thing was lost at this time anyway. But we go back to the vendor management, and at Rhapsody, we pride ourselves. We don't want to be called that V word. We don't want to be your vendor. We want to be your partner. So when you are going through a screening process, we want to be upfront with you and go along on that journey with you. We'll share all of the results from our cyber programs like ISO and SOC 2 and High Trust, but we'll also partner with you on your penetration tests and your game day events and disaster recovery and BCP. Because I think for all of us in this space, this protected information space, it's not a matter of if it's going to happen, it's when, and how quickly can you isolate the problem and recover and restore operations.
That is absolutely the key to the operation, getting back in business and taking care of patients and families.
Yeah.
Kevin, thanks for your time today. I really appreciate it. I'm glad you were on, and I'm looking forward to the next time our paths cross.
And me as well. Thank you so much for having me.
Thanks for tuning in to UnHack the News. And while this show keeps you updated on the biggest stories, we also try to provide some context and even opinions on the latest developments. And now there's another way for you to stay ahead. Subscribe to our daily insights email. What you'll get is expertly curated health IT news straight to your inbox, ensuring you never miss a beat. Sign up at thisweekhealth.com/news. I'm your host, Rex DeFord. Thanks for spending some time with me today. And that's it for UnHack the News. As always, stay a little paranoid, and I'll see you around campus.